She's significantly taller than me.
Okay, well, thank you. And I do want to give a special thank you to Dr. Shamlu of reminding me, again, because I do feel like at this point, even though I did not just graduate, I feel like I know nothing because I feel like everything changed. So I do have some notes from the stuff that happened yesterday while we were all here. And I will try and keep it focused on all of the things that we have yet to touch on through our presentation today. So again, my focus is going to be giving the oral health policy update and really trying to just give a lay of the land regarding what we're dealing with in our state. So of course, before I begin, I want to make sure that everyone knows I do not have any financial disclosures as part of this presentation. And again, all our presenters yesterday, the conversations that were happening from you all as attendees has really done a lot of the work and discussed what I was already going to talk about today. So I'm hoping that we can maybe fill in some of those gaps, as well as continue to focus on those opportunities for improvement, or opportunities where all of us can find something that we're comfortable or really passionate about to engage in. So with this, policy shapes all parts of oral health in three ways, if we really want to just narrow it down to the nitty-gritty, and that's access, care, and health outcomes. And these are not existing in a silo. They overlap because we know that if you don't have providers, you don't have access, and you're not getting a health outcome. So nothing exists in a silo. I hope all of you in your different positions at least have one of these three areas, if not a little bit of all of them, that you latch onto that is meaningful to you, because that's going to help you figure out, where is my piece of the pie when it comes to advocacy? What do I want to stand up for? Where do I want to make the change? So it helps myself, it helps my family, my community, my profession. So again, it's really understanding that no matter where you work in the oral health space, you are going to be impacted by policy and regulation at some point. And again, it's who gets care, who's delivering that care, what does it cost, and is it working to make a difference? Okay. Now, I am not going to take you back to your 8th grade civics class, but as Dr. Shamlin mentioned, it is kind of important to understand the differences between the different organizations at play, as well as looking at all of the different levels on which they exist. Because while I'm here to focus on the state, we can't ignore what's happening at the federal level, and we can't ignore how that impacts what's happening at the local level. So again, and Dr. Foss did an amazing job at really giving us a good lay of the land of all of the players involved at the federal level. So I encourage you to go back through and check her slides out if that's something you're interested in. But our federal government really sets the tone. So our agencies like CMS, HRSA, HHS, they establish national policies. They can, work with determining funding priorities as well as passing down regulations. And then it gets to our state level. So we have, individuals like Kelly Dupler, like Dr. Shamlu, Secretary Arkush, they're saying, okay, we're the ones now that have to say, and put into practice that day-to-day based on what the federal government is telling them. So again, our states make these day-to-day decisions by writing laws. We have organizations and departments of state with the State Board of Dentistry licensing our providers and figuring out what that day-to-day part of the pie looks like. And again, the local government is where it all comes home. So whether that's, you have a local health department that works with the Department of Health at the state, or you're talking about an FQHC who has a policy and regulation that is going to impact you as a provider. Or maybe it's your local water system that is impacting oral health. So again, it all comes back to policy becoming real-world care. Now, just to touch on PCOH in this space, one of our successes this year as an organization was to really put our policies on paper. And I want to thank, our PCOH board members, past and present, everyone who put our strategic plan together, because that is really the map from which we drew our policy agenda. If you have not seen it, it is linked here at the bottom of the slide. If not, we have it available on our resource table. But there are a lot of things. We tried to narrow it down to a top 10, but of course we're working in a lot of other areas as well. And it shows our priorities exist across all levels. So while we are a state-based organization, we do partner and get a lot of great information and support from federal organizations like CareQuest Institute for Oral Health and their Open Communities organization. And it gives us the chance to not just participate in federal advocacy events and go to DC and talk to the Pennsylvania delegation, but it's a learning environment and collaborative where we can talk to other states about how they're handling similar issues. Also, they have, because there are experts there focused on the national context, they're really great about giving us the information so we can focus on state and local here. Again, with our state level work, we are always looking to identify and make relationships with champions in our legislature and our administration. So when these changes come up and maybe they're not something we can get done on the ground and we need some of that stuff put on paper through law and that really long process, if we have a champion that can help move it through, we saw that maybe it doesn't have to be 7 years. It can be 2 years. And then again, our grassroots efforts, so whether that's partnering with organizations like Put People First, or again, an individual in their community that says, I'm losing my water fluoridation, I need help. How do I talk to my local board member? How do I deal with my city council? We're there to help with that as well. Again, I don't want to go too far into this because it has been touched on in so many other ways. But again, at the federal level, Congress and the administration really set our overall direction regarding health policy, and party control can definitely play into that. Prior to yesterday, despite having a majority in both chambers, the federal government was at a record-breaking shutdown. And they did pass a continuing resolution that will fund the government through January 30th. I will say I have not fully looked into that as far as what the changes are or could be. Again, this is where I'm going to really rely on our national partners to kind of talk about and dwindle all that language down and where we can understand what the oral health implications are. But the big impact, and I'm sure many of you felt it on the way here, federal shutdowns don't stay in Washington. The effects ripple out. So whether that was you had an issue with TSA or your flight got delayed or you're working with somebody in a family that's dealing with, oh my gosh, I'm going to have to deal with work requirements on SNAP now. The ripple effect goes the whole way to the community level. And it ultimately turns into how our oral health initiatives are carried out or maybe not carried out. So again, we talked about the One Big Beautiful Act, or H.R. 1. Again, Dr. Foss did a great job. Dr. Shamloo touched on some things. I do want to mention, especially with that workforce piece, I know Dr. Foss didn't get too into that, but there have been changes to specifically dental education or education funding that would affect somebody's potential ability to fund an oral health career. So there were changes to the Graduate Plus loan, there were changes to the Parent Plus loan, and then there was a borrowing cap set at $200,000. And we've heard the stories, we see the numbers. Many of you maybe even have experience of, yeah, my debt is way over $200,000. So again, it's really putting up unnecessary barriers to those who may be interested in a dental career, but not knowing how to overcome that. And again, all of the changes to Medicaid and the Affordable Care Marketplace, maybe they're not saying, oh, we're taking away dental, but when you affect somebody's budget by maybe limiting their SNAP funding or WIC funding, that tightened purse string means that they have to make concessions elsewhere. And we all know the research that when our budgets get tight, what is the first healthcare service that people forgo? It's dental. So, these are areas where we still need to be in tune and aware, even if it's something that maybe we're not advocating for directly. Okay, and again, Dr. Foss talked about Secretary Kennedy and his work with fluoride. Again, this really comes out of the MAHA Commission, or the Make America Healthy Commission, and their strategy report, which all of these resources should be linked. So again, I encourage you to check them out at your own interest or leisure. But the MAHA Commission was tasked with addressing childhood chronic disease. And when I saw that, there was part of me that laughed and wanted to cry at the same time because, again, in this room, we know what the number one chronic disease is, not just for children, for adults as well, and it's dental caries. It's dental disease. And I will say fluoride is under review. You can insert a different word there if it speaks to you differently. But the strategy report really does put fluoride under review, not just saying what are we going to do as far as changing recommendations or studying research that could require a change to our current water fluoridation recommendations from EPA, but also, again, like Dr. Foss talked about, those changes that the FDA have made in October, issuing guidance on ingestible fluoride supplements. So when we look at the federal context, there is legislation specifically geared toward dental as far as increasing access based on insurance accessibility. There's programs specific for addressing water fluoridation concerns, individuals with developmental disabilities. So all of this is on here. Again, I'm not an expert in any of these, but it is something that PCOH keeps tabs on and again relies on our national partners for more information. Okay, let's get to the state, and this is where we're gonna really probably dive in and set up for our local stuff. So again, we're not going to go back to 8th grade. Just know that the state government in Pennsylvania is unique across other state legislators, but for the most part, you can kind of look at it as mirroring the federal government and how it is set up regarding the executive branch lawmaking and our administration. And similarly, they passed a budget yesterday. So I will say did my best. I've got my breaking news here with everything I could try and pull out from the budget. But again, there's going to be more information forthcoming about what this specifically looks like. So when I get into some of these updates, please know that they may not be 100% accurate. So I'm just going to throw that caveat on there. But before we get into that, I of course have to mention PCOH's top priority that has been in existence since it happened in 2011 and for the entire existence of the coalition, and that is our goal to restore dental coverage for medical assistant recipients. So we have had really great, consistent prime sponsors that have been willing to reintroduce this legislation year after year. So last year, when we were working on this, and actually last summit is when it passed the House successfully with a bipartisan support. Unfortunately, it stalled out in the Senate. We couldn't get it out of committee. So we said, okay, we're starting again this year. Our primes were on it. They got it moved through the House quickly. And again, we saw success with bipartisan support, which is important. We are still in the Senate. Not a lot has changed, but there has been positive movement. So when HB 583 went through the House, it was amended. And what this amendment would do, it was kind of like a language clarification and really work to provide flexibility for DHS to have the option to restore the benefit incrementally. Because as we know and as we talked about, legislators can get a little shy when it comes to any legislation that has funding attached to it, especially if it doesn't come with its own funding source. And the DHS part of the budget is the largest part of the budget and is very, I don't want to say contentious, but it's always a negotiation point is what we'll say. So we were hopeful that this is kind of making it more palatable for our Republican-led Senate to say, you know what, hey, this is a good way to start getting back the return on our investment and supporting our workforce and supporting our dental schools who are treating this population, as well as all of your constituents who are reliant on Medicaid. Okay. Again, anti-fluoridation legislation, there hasn't just been talk at the national level regarding that, but what we have seen is that rhetoric has really emboldened not just individual organizations who are against water fluoridation or fluoride, but also legislators to fall in line or model some of the legislation that we have seen in other states like Utah or Florida. Now for Pennsylvania, these bills have just been introduced. At this time, our conversations that we have had, we are not anticipating any movement regarding this anti-fluoridation legislation, which would ban the addition of fluoride to public water systems. But that doesn't mean that we can rest easy, because we saw that when Harrisburg wants to get to work, they can get to work quickly. But right now, what we are hearing from our legislators is the environment doesn't call for a state mandate. And, there is a preference for keeping the individual choice at the local community. So this legislation would override that, and we're very much, being a Commonwealth, states' rights is important, and again, that trickles down to the community level of our community rights, our communities should be able to self-govern, especially when it comes to decisions like this. Okay. Again, we are also following the Dentist and Dental Hygienist Licensure Compact, and this legislation would allow Pennsylvania to participate in the Council of State Governments DDH Compact. And the DDH Compact is the only active dental compact currently, and it is active in 12 states, and there are 5 states with pending legislation. We do have more information in the next room on that. And I just want to highlight, we have saw so much momentum in the General Assembly around other health professional licensure occupations. Unfortunately, dental has not saw that same momentum. So that's where we need to get out as advocates. So if this is something that speaks to you, this can be an issue to get behind. Now, I do want to mention, and I think this is part of the reason why we haven't seen a lot of momentum, is dental, again, being unique as a profession, it also has a competing compact. So the American Association of Dental Boards has put forth their own legislation for an interstate licensure compact that would include dentists and dental hygienists. This has caused confusion among some legislators. They need educated on it. So that means to be very clear, if you're speaking to a legislator about either of these compacts, make sure you're referencing the bill numbers. Also, if you need assistance in understanding the difference, PCOH, as part of our workforce webinar series, hosted the Council of State Governments along with AADB on a webinar for them to each talk about their compacts and the differences. So we'll move forward. Again, so the Rural Healthcare Grant. When we talk about moving legislation forward and having a split legislator, we need to have priorities that everybody can agree on, because that's the best way to get things done. And rural health and workforce are 2 areas where if we can help move and mold the dental conversation into this, it can be really, really effective with reaching a lot of legislators and change makers. So I do want to highlight the Rural Healthcare Grant Program, which is HB 157, sponsored by Representative Kathy Rapp, along with Representative Dan Frankel. This legislation, similar to the primary care loan repayment, in where it is established and focused to help providers working in rural or underserved areas stay in those areas. But where it's different is the money would go directly to an entity employing those providers. So you would have to be an eligible RHC or FQHC. I think maternity access locations are included as well. And they would have the ability to apply through the Department of Health for one of these grants and use it for either recruitment incentives or retention incentives. So this was introduced last session, didn't make any movement. We petitioned last session to get dentists and dental hygienists included as part of that bill. At that time, the primes were not interested in amending the legislation, but this year we were successful. So, again, even if we're unable to see this through the Senate where it currently sits, because funding would be necessary, we are hopeful that they would keep dental as a profession if they were to reintroduce and push for this next session. So, again, sometimes it's just those incremental wins. I don't want to hit on the AAPD dental periodicity schedule because Dr. Shamloo did speak about that. I just want to thank him along with DHS for listening to the stakeholders, because what this does is, it raises the standard for Pennsylvania, and it aligns us with 20 other states that are also using this standard when we are looking at how we are screening our most at-risk children to make sure that they have the best dental health outcome. I do want to give a little bit more of an in-depth talk on the State Board of Dentistry, as far as, Ms. Donna Murray did a great job yesterday talking about what the State Board does. I want to talk about how it affects us and different ways that we can get involved as stakeholders. First off, there's a meeting tomorrow if anyone's interested in signing on. You can start tomorrow. But one thing that PCOH does is, yes, we are on those calls, not just because it's important for us to be there to assist in sharing information, sharing perspectives on behalf of stakeholders, but it's also to say, okay, well, what changes are going on and how is that going to affect our state, our patients, the profession as well from our perspective. So again, just as much as the legislative process is long, the regulatory process is just as long. And that is, when they're putting out these packages that make changes to how people practice, they put a lot of thought into it and how they write it, but then there's also the public comment and review, and it's a very long process. I won't go through it because I've heard board counsel go through it multiple times, but no, there are multiple opportunities to comment. And what we are waiting on for the IRRC to put out, because the state board has done their job in drafting regulations, they are now waiting for the next step to happen. And that's going to be talking about our general revisions. They also drafted regulations regarding mobile vans, which I know will be of interest to many of you in your organizations. There will also be an anesthesia update as well. But as far as work that we've seen completed, there has been the licensure by endorsement regulation that was fully in effect as of July 26th. And what this does is it just creates a pathway for recognized providers, so dentists, hygienists, and FDAs from other states, be able to get a license in Pennsylvania in a quicker and easier fashion, assuming they're in good standing and maintain all of those requirements so they are not a harm to our public health, because that is the state board's job. Okay, so again, I don't want to go into each of these because I'm sure someone's going to give me a time card soon, but these are some other bills and pieces of legislation that we are watching that, one, are probably important to you as stakeholders and your organization may be tracking more in depth, but are also something, if you're interested in more on, we can talk about later. Okay, so the local context, because yes, every community is different. We look at Pennsylvania and so many of us only see Pittsburgh and Philadelphia, and everybody forgets about the space in between. Well, somebody who lives in the space in between, it's very important to me. And it's also very unique. So we have 67 counties. We're a huge state. That's 2,500 plus municipalities. You have local health departments. You have workforce development boards who are also great and untapped partners that we are beginning to work with. Just 500 school districts. So when you're talking about reaching children, that's 500 school districts. That's not even how many schools in each district. So there are a lot of opportunities in your community to get engaged and get involved. And again, it's where when policies are written, they're on paper, it is the people in the community that are interpreting and carrying out these policies to say, okay, what do we got to do so we can get people care? Okay, so as far as what PCOH and where we engage mostly on the local level, of course we are supporting health systems, we are partnering with PAC, understanding what those state policies are, as well as how our FQs or our RHCs, making them successful, and where can we share this information across the board. But really our fight comes down to local water fluoridation and being present, being educators, being supporters to make sure that if there is a fight, that everyone is properly educated on the decision, because it is important. So while the Sunshine Act is not specific to oral health or healthcare at all, it is something that has been very, very helpful in the work that we have done. So just like I talked about rural and workforce being key areas that legislators agree on, transparency is one too. And that's what the Sunshine Act does. The goal is to shine light on what any board or decision-making authority is doing on behalf of the public. And that includes if they are changing their water fluoridation status. A water board or a water system, whoever's in charge of that decision, needs to be putting it on an agenda saying we are going to vote on this, and they have to do it publicly available within 24 hours of the meeting. Sometimes our water systems aren't doing that because our water systems don't see themselves involved in public health when they should. The other piece that kind of, puts a little frustration point in what we do is how the current guidance from DEP is written for our water systems. It is just a simple policy document like you would get from your healthcare system or maybe from your employer that says, here's what you do when. Well, it's very vague, and it gives a lot of room for interpretation. Unfortunately, how PCOH sees it and where we interpret it is it doesn't give enough defined, clear guidelines on public notification to give the public time to have a real conversation before a vote happens. So again, I see Helen on the move, so I'm going to keep moving. I don't want to touch on this slide because I can't replicate all of the conversation that came out of yesterday's advocacy panel and the engagement that you had with each of those representatives. But again, I want to simplify it by stay informed. There are so many different ways to do that. If you don't know how to get informed on something you're very passionate about, reach out to me, reach out to Helen, reach out to somebody in this room. We'll find a way so you can stay up to date, whether that's federal, national, or local. Refine your messaging. Come up with that elevator pitch. I know I've been very long-winded, but I can, if need be, do 3 minutes or less because a very smart woman in the front row said people quit listening after 3 minutes. So I remember that, Vanessa. Collaborate with others. Find your traditional partners. Find your non-traditional partners. The people who don't know that they are stakeholders, like water operators. And remember, change takes time. Everyone is doing their part, but again, sometimes we all get caught in the red tape, or we may be creating more red tape when we're trying to clear a problem, but the mission is honorable. Sometimes our method is flawed. And that is the bumper sticker that I will leave you with. Again, my contact information is all there. And I didn't get to the more specific parts of the state budget, but if anybody asks a question when I'm on the panel, I think I may be somewhat prepared. So.